Sure. We're working on several major campaigns. The first one I'll tell you about is about for-profit nursing homes and their attempts to stop regulations from being brought in that would improve patient care in nursing homes. So one of the problems in Ontario is that we have the most privatized nursing homes of anywhere in the country. Every wave of hospital cuts here has been accompanied by turning more and more of the nursing home industry here over to for-profit companies. And there are several very large multinational chains now that own a significant proportion of Ontario's nursing home beds. And with that change in ownership from public and not-for-profit to for-profit nursing homes, we've had a much more sophisticated and aggressive lobby campaign by the industry, by the owners, to stop regulations that would improve care levels. One of the major problems for them, of course, is that the more staff you have to hire, the less profit you can take out of the homes. And so they oppose at every step of the way improving the staffing levels, improving the care levels within the homes. So we've been doing a major campaign for minimum care standards to try and improve care standards in the homes and push back against this lobby campaign by the for-profit industry.
What kind of stories are you hearing from residents in care as a result of the privatization and the kind of changes that have taken place?
Well, all over the place. We hear from residents who are left in diapers, incontinence products, what people call diapers, and the staff are not allowed to change them until the diapers are 75% full. So there's a blue line on the diaper. They're not allowed to use another diaper until 75% of that blue line is full, because the homes are rationing the incontinence products to try and save money. We hear from people who can't get help going to the bathroom when they need to go to the bathroom, so they become incontinent. We hear from families who have to hire in extra caregivers if they can afford it, because there just isn't enough care to turn their family member over so they don't get bed sores, to feed them slowly enough so that they can actually swallow their food, to take care of them, to give them their baths, all of that sort of stuff.
And these are direct outcomes of the privatization.
Well, it's not so much the privatization as a combination of the private industry winning deregulation from the government. So it's the handover of the homes to the for-profit industry, and then you've got this big, powerful lobby group in this sector who push very hard for their interests. They're inside the doors of Queen's Park every day, which residents and family members don't get that kind of access to politicians. They fund political parties, and they get their way, even when it's counter to the public interest. And so that's really what's happened.
Tell me about the nursing home campaign. What are you doing? What does it look like?
Well, we just held a major summit meeting of family councils and unions and health professionals and concerned citizens, seniors groups, and other sort of interested public interest parties. We brought in some people from the United States to talk about what the for-profit nursing home industry is pushing for in the U.S. Because it's the same thing, and to bring some warnings about what they're doing there, so we understood it a little bit more. We've been engaged in the process that the provincial ombudsman is doing an investigation into nursing homes, into conditions in the homes. We've been engaged in that process. Now we're waiting for his report, which should be out shortly, and then the provincial government is coming out with draft regulations for the sector, and then all of our movements, all of the family councils, the concerned citizens, the seniors groups, the unions, the health professionals will be moving out, en masse in response to those regulations to push for what's actually needed. We're fairly positive that they're going to be inadequate.
Now, there's a related campaign around hospital closures and hospital reorganization. Can you tell me about that, please?
Sure. Well, the provincial government has set global budgets for hospitals at less than the rate of inflation. And so what that means is that just like in your household, when your income becomes less than the rate of inflation, you have to make cuts. And so right now, more than 50% of Ontario's hospitals were in deficit last year. More than 80% are going to be in deficit this year. It's unlawful for them to have deficits. The provincial government won't allow them to run deficits now, so they're forced to eliminate their deficits, even if it means eliminating medically necessary hospital services, beds, the pain clinic in a certain town, a fertility clinic in another town, shutting down emergency departments. And so that has thrown all of these hospitals into a major round of cuts. And what that looks like is wholesale closures of small and rural hospitals all across Ontario, closing down of emergency departments, closing of hospital beds, layoffs in the thousands of nurses and personal support staff and other support staff and health professionals in the hospitals, cuts to clinics, closures of services, and privatization.
What's the reaction on the ground in those kind of communities where hospitals are being cut?
It's been huge. It's massive. Thousands of people out, town after town after town, at rallies, town hall meetings. They've got petitions going all over the province. I'd say, there must be 50,000 or more petitions that have gone into the provincial government now. There's protests. We're holding protests on an ongoing basis. Municipalities have gotten involved. There's an alliance of municipalities that's forming around this. So it's all kinds of action happening. So far, the province, though, has ducked the criticism. They set up regional health bodies that they are hiding behind. They're all appointees of the provincial government, but they're hiding behind these appointees to escape the political blame for this. So we're trying to ratchet up the pressure on the McGuinty government. These decisions are made by the provincial government, who ought to be held accountable for them.
It seems ironic that the provincial Liberals in the last couple of election campaigns ran on very strong platforms supporting public health care, public services. This seems quite ironic.
Well, yeah, I think that the way that privatization happens is partly because there are some people within the Liberal Party and within the government that are pro-privatization, partly because of the power of the lobby groups and the fact that the decision-making processes are so undemocratic that really the for-profit industries are in there way more than anybody else is, lobbying for what they want, and they get more of it than anybody else does. And partly just by mistake and by incompetence. Obviously, if you cut physiotherapy in your local hospital, there's no other place to get physiotherapy but a private clinic. That means for-profit privatization of physiotherapy, which for patients means you have to go then and pay out of pocket for what once was provided as a public service. And that sort of thing is happening all over the place. And, I think the provincial government isn't fully cognizant of the consequences of what it's doing. And because it's so profoundly undemocratic, because all of the norms of democratic process, debate in the legislature, public consultation, actual legislation that has hearings and so on have been avoided, there is no feedback loop.
What are you encouraging citizens to do if they're concerned about what you're talking about?
They need to contact Premier McGuinty. I mean, the target now is the Premier. The Ministry of Health is pushing this. It's the Premier that can overturn it if he chooses, and so they need to phone, fax, email, write a letter to Premier McGuinty and tell him what we want out of our healthcare system.
And you have a website that can encourage them and help people to do that sort of thing?
Sure, yeah. It's www.ontariohealthcoalition.ca.